Hello guys, welcome to my channel Dentistry with Keshav. Don't worry guys, relax. You have to study smart, not hard anymore. Okay guys, our topic of discussion is, guess what? Fusion versus gemination. Okay, what is fusion and gemination? Fusion is a union of two separate tooth germs, usually two adjacent teeth, to form a single large tooth. And gemination is an attempt of a single tooth germ to divide into two, resulting into a single tooth with a bifid crowns. Okay, now let's make it more easy guys. Understanding fusion. You can appreciate two separate tooth germs that fuse and give you a large tooth which is formed by fusion. Now understanding gemination. Here is a single tooth germ. It is trying, it is attempting to divide into two bifid crowns. Now, let's compare their main characteristic features. Okay, first we are going to discuss fusion. So, it is formed by the union of two separate tooth germs, we already discussed. Usually involves the two adjacent teeth in any quadrant or any arch, upper or lower both. Tooth count in the arch is reduced by 1 and may have two separate root canals or more. Like we see that two separate tooth germs were uniting. So of course it would have two or more canals and the resulting tooth is larger than normal. And giving you an example, you mostly appreciate this condition in a mandibular little incisors and canines. What are the characteristic features of gemination? It is formed by an attempting of a single tooth germ to divide. We see that it was trying to divide into two and making a bifid crown. If you remember, it involves only one tooth and the tooth count in arch is normal. We are going to discuss this point later, okay? It usually has a single root canal. Of course, the single tooth was trying to divide and the resulting tooth is normal in size and slightly larger. You can see the most common example is a maxillary lateral incisor. What are the clinical difference? What scenario they are going to give me in exam and we are going to differentiate fusion from gemination or macrodontia. Yes, macrodontia. Okay, the tooth count in the arch is reduced by 1. We said that the two teeth were combining. So of course, one tooth is reduced, that appears 1. When you count the whole dentition, you will see that the dentition is reduced by 1. So that will be fusion. And the tooth count in the arch is normal. We were seeing that single tooth may be increased. Sometimes it is divided, you will confuse it into two tooth, but no, it will be a one tooth, okay? So the tooth count in the arch will be normal. So you have to mark it as it is as gemination. Okay, the summary point. I love this slide and I love to study like this. Fusion versus gemination. Let's summarize the whole topic. Union of two separate tooth germs will be fusion and attempt of a single tooth germ to divide into two bifid crown was gemination. In fusion, two adjacent teeth, we took the example of lateral incisor and canine, and in gemination, single tooth was divided. Any tooth could be involved, but we said that maxillary lateral incisors are very common. Okay, in fusion, we said clinically the tooth count will be reduced by 1. In gemination, it will be normal. In fusion, it will involve usually two teeth or maybe more. It will have two or more canals. If you are going to do RCT of such tooth, you have to make sure the proper X-ray of the tooth to identify the canals and then perform your endodontic procedures. Usually two or more canals are present and in gemination, it is usually one. It is easy one to treat. Okay, in fusion, larger than normal tooth appearance, you can appreciate. It may be larger than normal, okay? And it might be normal or slightly larger. Now, you have to screenshot this slide and you have to remember this for your exam and remember the examples. Okay, thank you so much guys for watching me. Stay tuned for next part because this is being complete and don't forget to subscribe this channel.